We have time for some questions. Where there's microphones, one on each side. And if you'd make your way to the microphone. And if you don't have questions, Bill Dietz will have questions.
Is there any, what does the data show as to the reason why we're starting to see this glimmer?
That's a great question. So as we've looked across it, much of the data then, if we think about, I often say if we brought people together and we say what causes obesity, I think we'd have at least 157 Post-it notes on a wall, or we'd pull out the Foresight model and look at all the complexity of the factors that are going into this. So as we've tried to disentangle and answer that question, we've been kind of ecologically looking across what do we know in the states where we've seen declines, what do we know in the communities. So NCORE, the National Collaborative on Childhood Obesity Research, has actually done a deep dive in 4 of the communities that were shown on the map. And they're right now they've put up the summary reports online and they're writing papers right now. But we're seeing this set of policies that are happening across that life course. So we're seeing policies related to nutrition, physical activity, and childcare. We're seeing that they had the WIC food package had come along. We're seeing some changes in those stores that are offering those. We're seeing good district wellness policies at the school. We had already seen through the SHIPS and profiles data at CDC some of the changes that were happening in school food and in those areas. So I think we're getting a sense, through those kind of key informant interviews and then looking at the policy context of what was happening. In those communities, there's always strong community coalitions. Engagement with business leaders, engagement with child care and school, engagement with parents who wanted to be more of advocates for their children. So I think that's going to emerge. The problem is it's messy. It's not one simple answer. And so I think that's where we'll have to, again, probably refine the message as we go forward as people ask us that question. Because right now we've really had to look at it ecologically or do some of these deep dives post hoc and really try to find that. But it is what we were suspecting in those communities is really the policies and practices in those settings. There's a lot of areas related to obesity that are emerging. As a research scientist, we're keeping our eye on the research around the microbiome, on sleep, on how stress and ACEs, on environmental chemicals. So I think for those of us in this space, we have that hat on as well, that we're not going to, just come over here and say this is the simple fix. We're going to keep looking at the evidence, but I think that's the role of all of us is to keep supporting and continuing resources to keep evaluating in these communities and to keep the science going.
Thank you.
Join me in thanking Captain Blanck.